Understanding Pompe disease. Causes, types, and modern treatments. Pompe disease is a rare, inherited genetic disorder that fundamentally disrupts how the body processes energy. Specifically, it is caused by a deficiency in the enzyme acid alpha-glucosidase, GAA, which is responsible for breaking down glycogen, a complex sugar stored in the muscles for energy into simple glucose. When this enzyme is missing or insufficient, glycogen accumulates to toxic levels within the muscles and organs. This buildup leads to progressive muscle weakness, tissue damage, and life-threatening complications involving the heart and respiratory system. The two primary forms of Pompe disease, while the underlying genetic cause is the same, the disease manifests differently depending on when the symptoms appear and how much enzyme the body produces. Infantile-onset Pompe disease, IOPD. This is the most severe and rapidly progressing form. It typically appears within the first few months of life and is often characterized by a near-total lack of the GAA enzyme. Key risks. If untreated, IOPD can cause an enlarged heart, hypertrophic cardiomyopathy, severe breathing difficulties, and failure to thrive. The CRIM factor. Medical professionals categorize IOPD patients based on cross-reactive immunological material, CRIM. CRIM-positive infants produce tiny amounts of non-functional enzyme, meaning their bodies recognize the replacement therapy as self, making treatment easier. CRIM-negative infants produce no enzyme at all. Their immune systems may view replacement therapy as a foreign invader, requiring additional medication to prevent the body from attacking the treatment. Late-onset Pompe disease, LOPD. LOPD develops more slowly and can be diagnosed at any age, from childhood through adulthood. It is characterized by a partial deficiency of the GAA enzyme. Progression. Instead of affecting the heart, LOPD primarily targets the skeletal muscles. In children, this might look like clumsiness or delayed motor skills. In adults, it often presents as a progressive muscle wasting disorder. Impact. While less acutely fatal than the infantile form, LOPD can lead to significant long-term disability, including the need for mobility aids like wheelchairs or respiratory support. Identifying symptoms across the lifespan, because the disease progresses at different rates. Symptoms vary significantly based on the patient's age. Stage common symptoms: infancy muscle, floppiness, slow growth, difficulty swallowing, breathing, and enlarged heart. Childhood exercise intolerance, scoliosis, curved spine, frequent respiratory infections, and nasal voice. Adulthood progressive weakness in legs and trunk, loss of balance, chronic pain, and difficulty chewing. Diagnosis and genetic inheritance, how it is found. Diagnosis usually begins with a simple blood test to check GAA enzyme levels. If levels are low, doctors may confirm the diagnosis through DNA testing or a muscle biopsy. Additional tests, such as sleep studies or electromyography, measuring muscle function, help determine the extent of the damage. How it is passed on. Pompe disease is a recessive genetic disorder. This means a child must inherit a mutated gene from both parents to develop the disease. Parents can be carriers, meaning they hold the gene but show no symptoms, and have a 25% chance of passing the condition to each child. Modern management and treatment. While Pompe disease is currently incurable and requires lifelong management, medical advancements have transformed it from a fatal condition into a manageable one. Enzyme replacement therapy, ERT. The cornerstone of treatment is ERT, which involves regular intravenous infusions, often every 2 weeks, of synthetic GAA enzymes. There are currently 3 primary options in the U.S. Alglucosidase alpha, the original first-line therapy, essential for infants. Alpha-glucosidase alpha, a newer version designed to target muscles more effectively. Sipaglucosidase alpha plus miglustat, a combination therapy for adults who may not respond sufficiently to other treatments. Supportive and lifestyle care. Because ERT cannot reverse all existing damage, a multidisciplinary approach is vital. Therapies. Physiotherapy for strength, occupational therapy for daily tasks, and speech therapy for swallowing, speaking. Respiratory support. Use of supplemental oxygen or BiPAP machines during sleep. Dietary management. A high-protein, moderate carbohydrate diet is often recommended to support muscle repair while managing sugar buildup. Physical activity. While overexertion should be avoided, controlled resistance training and low-impact aerobic exercise are increasingly recognized as beneficial for maintaining function. Summary: Pompe disease is a progressive, lifelong condition driven by glycogen accumulation. While the severity varies from infancy to adulthood, early diagnosis and consistent enzyme replacement therapy are critical to slowing physical decline and improving quality of life.